G'day everyone, welcome back to the channel. So in today's video, we're going to go through some exercises to help you treat your tibialis posterior dysfunction. Now, that can be some muscular issues, that can be some tendonitis or tendinopathy issues. But when we're having a conversation about how to fix some tib post dysfunction, we're really having a conversation about the arch and arch function. So the exercises that we're going to go through today, we're going to go through one exercise that will hopefully help your tibialis posterior symptoms. But we're actually going to go through 2 or 3 other exercises that are going to try and capture the main reasons of why that becomes a problem in the first place. So as you probably know from watching some of our videos before, it's not enough just to treat your symptoms. So if you have some tib post dysfunction, you definitely want to treat those, get it stronger, mobilize it, improve sort of your pain and dysfunction in that area. But if we're not also having a broader conversation as to why that one specific part of your leg has become a problem, then we're not necessarily getting to the root cause of the dysfunction, and we're not treating the broader issues that have set it up to fail. So if we can do that, then we can start to have a conversation about you being someone who used to have tib post dysfunction and not someone who may get it again in the future. So if you hang around towards the end of the video, we're hopefully going to go through those symptomatic exercises, but also the ones that hopefully get to the root cause of that tib post dysfunction as well. So as I said, when we think about tib post dysfunction, we really need to have a conversation about your arch and what your arch is doing. And the reason being is that tib post muscle originates from sort of the inside of that shin, and it turns into the tendon, and that tendon anchors down onto some of the bones of your arch. So what we see a lot with the arch, if that arch is consistently flat or collapsing, we're always sort of creating unnecessary and unwanted tension or extra tension through that tib post muscle and tendon complex. And over time, if you're loading that tendon up dysfunctionally in a way that is not designed to handle day in, day out, then that dysfunction can become a reality and turn into pain and cause other dysfunction down the track. So the exercises, as I said, that we're going to go through is we're certainly going to try and sort of clear up some of the dysfunction associated with the tib post, which we'll use a lacrosse ball for in a second. Where are we? There we go. But the broader conversation that we're going to have is how do we improve the way that your arch functions in the context of your leg so that it doesn't come back again or it goes away faster. We want to set the conditions, create a healthy environment for that tib post to improve and to get better long term. So the first exercise that we want to go through again is a really simple one. You can use a lacrosse ball, a tennis ball, you can use your thumb, you can use anything that you feel gives you some confidence that you can get into the right spots. And all we're going to do here is we're going to get into that tissue itself. So how that looks for me, again, if you can't get into this position, you can certainly do it on a bed or on a bench or something as well. But for the purposes of the video, we'll do it through here. So what we want to get you to do is we want to get you to find the shin bone at the front, and just back from that is generally where that tib post muscle tends to reside. We're going to get the ball into that area. Now, one of the things that we can do is we can sort of compress and roll if you want to. But one of the things I find works even better here is if you find a spot that feels particularly gristly or tender or uncomfortable, put a bit of pressure on that. And then what we're going to get you to do is we're going to get you to pin that down and then move your foot around instead. So we're sort of it's an attack and floss exercise. We're getting some tension on some of that restricted tissue, and then we're using movement to shear that tissue free underneath that ball. So one of the things we can do is just dorsiflex or bend that foot backwards and forwards, and you'll feel like you'll generate some tension under the ball. And after a few of these, it should start to feel like it frees up and becomes a little less tender. Now, because this tib post muscle sort of helps to sort of supinate and turn the palm of that foot upwards, we can also incorporate some of that sort of pronation, supination in here as well. So instead of just going up and down, we can start to go sort of in and out. So turning that sole of the foot inwards towards you and then away from you. You'll feel that as you turn it away from you, you'll get a lot more tension through that tib post area. And obviously you can do both at the same time. So a bit of dorsiflexion and some eversion there, some inversion to allow that tissue to free up. So we're trying to basically shear free some of that tissue, feed some slack back into the arch of the foot. And remember, if that arch is constantly collapsing or constantly doing something it shouldn't, this tib post muscle is often carrying a lot more load than it should, so it's a lot easier for it to tighten up over time. So we can free up that tendon and free up that muscle, again, working all the way up and down, basically down towards the back of your ankle bone and up in towards the meaty part of the calf until you start to lose that. We want to start to sort of feed some normal dysfunction back into that. And that alone can be a really powerful exercise to help any associated symptoms. And of course, there's plenty of other symptomatic exercises that we won't get to in today's video, like rolling the ball underneath your arch as well. There's some specific strength exercises that you can use where you're sort of gripping the floor with your foot and then trying to create that arch and get the intrinsic muscles of your foot and that tib post muscle to fatigue. There's exercises where you can tie a TheraBand or a stretchy band to your foot, and you can sort of pronate and supinate, sort of pulling that band towards you, and again, sort of fatiguing and stressing that tendon as well. But from a symptomatic perspective, I find if you feed a lot of slack into that tendon, to that muscle, that can be a really fast acting way to provide yourself with some symptomatic relief. And then you can work on the strength exercises and maybe some work under the foot as well. But what I wanted to get to for the rest of the video is the broader contextual stuff, the stuff that potentially sets all of this up to fail in the first place, the stuff that if you don't address these broader issues, you potentially have to keep doing the more specific stuff over and over and over again, because you're not necessarily getting to that root cause we spoke about. So what we want to do next is we want to start to look at your tib post in, I guess, in the context of what your leg's doing. And in order to sort of highlight this, we want to have a look at what the arch does when your leg's not doing the right thing. So often a lot of people with tib post dysfunction will naturally, well not naturally, but they will have come to stand with their feet turned out. And what that does is that forces you to sort of walk on the inside of your foot. So instead of having your feet straight and translating the force through the center of your foot, turning your feet out sort of directs that towards your big toe a little bit more. And what we see is that the arch tends to collapse when your leg rotates inwards. So what we want to basically do is, in order to keep those arches up in a good position, we want to train the body to be able to externally rotate your whole leg, which is a movement that happens at the hip. And by doing that, we're going to create more stability at the arch and take the tension off, or the abnormal tension off the tib post, and ask it to do what it's designed to do naturally. So one of the things we can do here, and again, we've covered this a lot on the channel before, is that we know that if your ankle is stiff, so if you have some stiff ankle joints, so we're not necessarily talking about muscular tightness here, but stiff ankles, even if your feet are straight, your knee can't translate forward as far as it wants to. So it reaches the end of some mobility, it's going to dump inwards to try and get around that stiffness. And again, what happens when that knee dumps inwards is the whole leg rotates inward and that arch collapses as we translate forward. So we're automatically loading up the entire leg, including that tib post, differently, simply because the joint itself is stiff. Now, again, if you're a fan of the channel, you'll know the best exercise I've ever seen to free up a stiff ankle is with a power band around the ankle. You want to stretch that out as far as you feel comfortable, leaving that back ankle behind, and you want to translate your hips forwards. So we're not squatting down on this, we're bringing our hips past your foot and then bending your knee a little bit just to tension up the ankle, and we're just hanging out here. Again, as always, just to show you from the front like we always tend to do. Again, if that ankle runs into some stiffness, the knee's going to want to dump inwards to get around that. So make sure that when you're stretching, you're not allowing that knee to cave in unknowingly. We want to keep the knee out as far as you feel you can rotate. So essentially, we're not necessarily just stretching the knee in a forward plane. We're actually going forwards and out towards the outside of your foot. Again, without your foot actually lifting up off the ground. So the foot stays straight, rotate that knee out, create that stability at the hip and at the arch. And then we want to go out as far as we can, as far as your mobility allows, and we want to hang out here for a minute or two. So again, hang out here for a couple of minutes, do it on both sides if you're having issues on both sides. But we want to basically, it will allow that tib post to not be included in the conversation as much as it would otherwise. So that's exercise number one. So we're freeing up your ankle joint to allow your arch and your tib post to be loaded better long term. The second piece of the puzzle is we want to look all the way up to the top of that hip joint. And as we said, the dumping inwards, that internal rotation of the leg, is a component of the hip just as much as it is the ankle. So a lot of times people get really tight where their hip external rotators don't allow them to go out into this really strong, stable hip position, stable knee position, stable arch position. So if you're lacking that external rotation at the hip, then you can often be stuck playing in this sort of relatively internally rotated position long term, again, setting that arch and the tib post up to fail. So Again, one of our favorite exercises is the pigeon stretch. So again, you don't have to do this on the floor. You can do this on a chair, you can do it on a bed, it doesn't matter how you do it, but essentially all we're doing here is we're trying to rotate that leg inwards. For the purposes of this video, I'll do it on the floor, but the idea here is that you want to be up nice and tall, and you want to externally rotate that leg or that hip as far as you feel comfortable. And in a perfect world, you should feel that stretch right in the back pocket area. It'll feel nasty for a lot of people. But again, what we're doing is we're dropping down as far as you feel comfortable, and like any stretch that we do, we want to make sure that we tense that tightness up for 5 or 6 seconds, just so that we can get that to relax. So for me, this is as far as I can go comfortably. If I give those glutes a bit of a squeeze, so I'm trying to squeeze the muscles that feel tight, hold that for 5 or 6 seconds. When I relax, I can now drop down a tiny little bit deeper than before, give them another good squeeze, hold it for a few seconds, and then I relax and I can drop down a little bit deeper again. So the point being is that when I come up again, because I've been stretching myself in this position, it's the same as getting myself into this position when I'm standing. So what I've just done here is I've just given myself a little bit more room to move in this externally rotated shape than what I had before. So I have decent hip range, but for everyone else who has some tib post dysfunction, you might find that you can take your knee from getting out from this position all the way out to here relatively comfortably. You're giving yourself a little bit more room to move so you can create a better, more stable platform to work from. So that's exercise number 2. So the first one's obviously from the previous, at the start of the video, we're trying to take care of some isolated specific symptoms involved with that tib post tightness. Exercise number 2 is the ankle stretch to take away one of the handbrakes that your body has to work around that changes the way you load up that tib post. Exercise number 3 is freeing up those hip muscles, those external rotators, or the muscles that restrict external rotation, so that you can put your whole leg in a better position, and it filters down and allows you to put your arch and your foot in a better position, loading up that tib post. Now the 4th exercise and the final one that I wanted to touch on is we do want to go through some strength related exercise to make that more palatable, to make that more normal, to make that externally rotated shape more robust. And what I find works really well is just a really simple squat exercise. Now, as I said before, you can do some isolated work where you're gripping a towel on the floor with your foot, trying to scrunch it up and really lifting up that arch, training those muscles to stabilize better. Specifically, you can add a band and then do that sort of eversion, inversion to really strengthen the muscles in that sense. But again, the purpose of this video is to talk more broadly and try and get you thinking about the broader ramifications of leg dysfunction. And as I said, the best way to sort of practice this sort of feet straight, externally rotated position to put your arch and tib post in a better functional shape is just with some squats. So again, this is another one we do a lot, but with your feet straight, before we do anything, we want to screw those knees out and create that external rotation through the hip, lift those arches up in a really good position without going too far and lifting that foot up off the ground. We're going to plant those feet, externally rotate, and then all we want to do here is we just want to poke your bottom out like you're going to sit down and just do a couple of mini squats to begin with. Now, if you have decent range of motion, you may be able to get down a little bit deeper, but for the purposes of this exercise, the depth doesn't matter as much as creating that externally rotated shape, sticking them in that position, and then just hinging up and down on top of that. Now, if this is too easy for you and you don't feel like it gives your glutes a bit of a workout, you can invest in one of those booty bands or a TheraBand that go around your knees, and you have to hold those legs out under resistance while you're squatting at the same time. And from what I find clinically, it's a really, really quick and fast acting way to restore more and more normal function to those legs, allowing it to filter down to that tib post, loading it up better, taking away the reasons why that has to be dysfunctional in the first place. So hopefully those 4 exercises are really helpful. Let me know in the comments down below, how is that tib post going for you? Is it something that you've had trouble with for a long time? Is it something that is just fresh for you? Have you found some things that work really well? I'd really like to hear what you have to say in the comments. Let me know how you're going. And the other thing I wanted to touch on, excuse me, comes back to things like shoe inserts and orthotics. Things that, when there's any arch dysfunction in the conversation, they're often things that get sort of entered into that conversation quite readily. And while things like arch supportive shoes, arch supports, inserts and those sorts of things, taping as well, arch supportive taping, I really want to categorize those as short-term solutions because they may stop your arch from collapsing because they physically block it from collapsing, and that may help with your symptoms. It may give your tib post a couple of days or a couple of weeks of respite to allow it to settle down a little bit faster, but it doesn't stop your arch from wanting to collapse, which is the key point, I guess, that sort of filters throughout this video, in that if we're not addressing the ankle stiffness, that hip rotational tightness, and some of that sort of lack of hip strength, that rotational hip strength, then we're not really stopping the whole leg from dumping inwards and flattening that arch that arch support is trying to stop. So the goal with any of these exercises in this video as well is that at some point, if your mechanics have improved enough, you should be able to get to the point where you don't feel like you need those arch supports, whether it be a shoe or an insert or some taping. They're just not something that you feel you need anymore because they serve their purpose to get you over that painful hump and get you to a place where you feel really comfortable, but you've got to take over the broader mechanical stuff so that you don't need that anymore. Because you shouldn't have to, your day-to-day life shouldn't be dictated by footwear or shoes. If you wanted to wear a certain pair of shoes but your orthotics don't fit in, if you can't walk barefoot, all those sorts of things, they're more of a short-term problem and not a long-term fix. So just wanted to throw that in at the end. So again, if you went on to enjoy the video, we'd really appreciate you leaving a like below and consider subscribing if you're new. And if you like these sorts of tips, you like the broader perspective, and we talk a lot about the underlying cause of a lot of the common problems that we see day to day. And if you like that kind of information, or you just want to interact and learn more about how the body works and how the body works best, please consider subscribing just so that you get that information as it comes out. And it obviously helps us out as well. It helps us grow, and it helps these ideas sort of get out to more and more people, which is the ultimate goal. So again, thanks for watching. Hopefully that was useful, and then until next time, we'll see you soon. Bye.